But you know what we should talk about?
Yes.
We should talk about the fact that you are available on social media for anyone out there who might need your help, Dr. Irfan.
Yes, we should advertise the Facebook page. We've already had lots of people write in, and some very complex medical cases that need a neurosurgery and different types of very advanced treatments. I mean, these types of questions are trickling through with videos of people and patients. Yes, we've had all kinds of people reach out to us, and I'm sorry if there has been a delay, because I think most of our audience is very spiritual and faithful, and what they really want to hear is they want to know if there is a natural cure or a miracle that could be done in very advanced cases of certain neurodegenerative conditions, for example. And I've been telling them, look, I have to obviously also get some information from our Imam and get back to you. And his life, of course, is extremely busy, but we are getting responses slowly but surely to those people who are out there. And anyone who wants to reach out, there is a Medicine of the Mahdis Facebook page that has been opened up, where people do write in and ask us questions. So if you're somebody who has a particular medical ailment and traditional methods have failed, then you can certainly reach out and we will do our best to help. Myself and my colleague Dr. Yasmin run this kind of Facebook page, and we are trying our very best to keep a pace with all the requests and questions that are coming through.
So people just have to go to Facebook and search Medicine of the Mahdis and they'll find you.
Absolutely.
Go ahead and do that, guys. Go find Dr. Irfan and get in touch if you want regarding your medical ailments.
Yeah, no, you should do. And we always release every week some spiritual advice from the prophets and the messengers about certain health topics. And one of the health topics which we have spoken about is the one that we're going to cover on the show, which is about oral hygiene.
Okay, let's do it. Let's get right into it.
Let's get into it. So before we launch into the slides,
should have brought some props.
Huh? Should have brought some props.
That would have been interesting.
Or like a skull, and then
bit
open
of floss or a toothbrush.
Yeah, we go straight to the skull. No, we should have had some, but yeah, I think we have some good slides. I think the slides will make up for it. But we always say we take lessons from various things, and I gave an example of sports. And I remember very, very vividly something that left an impression in my mind as a youth. It was 2002, and this manager had come into the Premier League. He managed the biggest rivals of my team that I supported, which is Manchester United, the best team in the world. And then you've got Arsenal that had Arsene Wenger, and he was this guy who had come from Japan, and everybody was looking down at their noses at him because he had some very strange methods that he was introducing into soccer. And one of them was that he had all of the players of that Arsenal team really extensively scanned for the health of their teeth, their oral hygiene.
That's interesting.
Yeah. He sent everybody for testing and looking at the health of the gums and the teeth and the dentition, and he had reports filed on them. And anyone who didn't meet a certain level of dental hygiene, he actually said, they're out of the team, sell them, I want these players to stay and these players to go. So it was a very interesting sort of method that he used. And actually he came before 2003, but I mentioned this year for a specific reason, because this is the only team in Premier League history, and for the soccer fans out there, they know what I'm talking about, that went the entire season undefeated. They didn't lose a single match. This has never happened since the inception of the Premier League.
Because of their good teeth?
These were some of his interesting methods, and I thought, wow, he was really that obsessed with oral hygiene. And then when he was asked about it in an interview in a magazine, which I read, he said that he really did believe that there was a very strong connection with cardiovascular health and one's fitness levels with their dental hygiene. And then, of course, we all know he came from that school within France. He was a Frenchman. France had won the '98 World Cup, then they won Euro 2003. So they were the best team in the world. And the managers coming from France had these different principles and values of looking at fitness and health, and oral hygiene was considered among them. So I became fascinated by that. And then when I went to medical school a couple of years later, after the Invincible season, we didn't get much training in dentition because we're not training to be dentists, but I do remember that there was a lot of talk about cardiovascular diseases to do with the heart and the teeth, and one of them is very, very well known, called infective endocarditis, where you essentially have bacterial infections that affect the valves inside your heart, and this was found in people with poor dentition. And since then, more and more studies are showing connections with Alzheimer's, dementia, and other cardiovascular diseases that are very serious and significant that are all related to oral hygiene.
Wow.
So not just athletic performance and peak performance in sports, but also in everyday chronic health conditions. People with type 2 diabetes also had problems in certain gum conditions that was made much worse by virtue of having gingivitis, and they're more at risk of plaques and tartar and all this stuff. So yeah, let's start off. So it's very, very important topic.
Quite an intro, I have to say.
You have
I
to
would
set
never
the stage.
have thought that heart disease could ever be linked to teeth.
Yes.
That is insane. That's crazy. I really need to hear more about this.
And this is something the Prophet Muhammad, peace be upon him, and his family spoke about extensively. And the Ahlul Bayt, the Imams who were his true successors and caliphs, had many, many narrations. And one of these narrations is going to be coming up very shortly on the television screen, and we're going to read through it, and we're going to see some of the benefits that Imam Jafar as-Sadiq, the sixth Imam and successor of the family of the Prophet Muhammad, spoke about. So let's put that narration up on the screen. And here it is. Imam as-Sadiq, from him his peace, said, there are 12 distinctive features to brushing one's teeth. So these are the benefits of brushing your teeth. It is the practice of the prophets. It purifies one's mouth. It improves one's eyesight. That's very interesting.
Wow.
It pleases Allah subhanahu wa ta'ala, God Almighty. It whitens the teeth. It does away with wretchedness, depression, basically is what it's talking about. So now there's a connection with mental health.
Wow.
Absolutely.
Who would have thought?
And there is a lot of evidence that is coming out now that those people with mental health issues, they seem to all have poorer dentition than the people who don't have mental health issues. So there's a connection there. It strengthens one's gums, and one's gums, as we will see now, are very, very closely tied to your cardiovascular health, your blood vessels that connect all of your body. It whets one's appetite for food, meaning it helps with digestion. It takes away phlegm, which is that sticky, gooey stuff that we all produce, which leaves us more vulnerable to chest infections and throat infections. It improves one's memory. And there you go. Alzheimer's, dementia patients have significantly...
Wow, this is amazing, right? This hadith is pulling in all the things that you were saying that have been found in studies.
Yeah, I thought this was a fascinating hadith, and we have so many cases now of people who have had their dentition checked, and they always invariably have poor dentition, and Alzheimer's dementia is linked to it. So the vessels that carry your blood from your gums are also connected to your brain as well as your heart, and I mentioned infective endocarditis already. Then it says it multiplies one's rewards for good deeds. What's that about?
Just by brushing your teeth.
Isn't that interesting?
Just try doing that.
And it gives pleasure to the angels. So the angels like to sit in your company when you have good oral hygiene versus having a bunch of onions and garlic. Probably, I would make that.
That is amazing. And all you have to do is brush your teeth, which we're doing twice a day.
Twice a day, yeah. And we're going to talk about the ideal regimen to have as we move on to the next slide, please. So there are three things that we really have to be having in order to have good dentition. The first one we're going to talk about is toothpaste. Now, we all should be using toothpaste with fluoride in it. Yes, fluoride has to be present because fluoride kills that bacteria that takes root on our teeth and then goes into our gums and causes all manner of problems. And fluoride kills them. We're not going to be eating the fluoride, we're not going to be swallowing the toothpaste, but we're going to be putting it on our teeth and then spitting out what is left over. We are not going to be gargling our mouth with a bunch of water, and the idea is to leave a very small amount on the teeth, and 1440 parts per million is very, very safe. Actually, children can even take that amount of fluoride in their toothpastes, and it prevents cavities, and there's so much research. It's completely undeniable now that fluoride protects your teeth, and those kids who don't brush with fluoride, they're the ones who get all the cavities. So,
and also we know that Abu Sadiq has answered a question that somebody asked him in the Q&A sessions that he was doing, and he had made it very clear that fluoride is actually necessary, because this is actually a question people do have. I think it's a point we should
They're worried that it could have block their pineal gland and their third eye and all that stuff. Yes.
There's this fear, this phobia now for when it comes to fluoride, but Abu Sadiq himself has said very clearly it is totally not just permissible, but you have to use it. He said you have to use fluoride in your toothpaste, because if you don't, it's not going to be effective, is it?
Yes, exactly. And it is essential to use. And again, anything over 1440 you can only get via prescription. So all the over-the-counter toothpaste have this amount in, and this is the correct amount to be using. If you are prescribed a stronger fluoride-containing toothpaste, then it's usually done by a dentist who looks at your teeth and says, look, there's a real problem with the enamel here, and in order to prevent cavities, I suggest and recommend that you use a stronger fluoride toothpaste. And only under those circumstances should you be using it. So yeah, I think the evidence is overwhelming that fluoride is a positive and not a negative, so long as you are not ingesting it. I would recommend, however, with the children, just be more careful with the younger kids. Have a look at the fluoride content, and if you can find something with less fluoride in it, then go for it. But it has to be over 1,000. The World Health Organization did a study that anything less than 1,000 didn't actually have any benefit whatsoever. So it has to be 1,440 to 1,000. Anything less than that is not really going to be effective. So let's bring up the next slide. Now, this is the second thing. So we've talked about toothpaste. This is flossing. This is really extremely important because, Alia, 40% of your dental surfaces lie between your teeth and they are inaccessible to the toothbrush. Wow. 40%, right? That's
a big number.
Yeah. And there are many ways to do interdental cleaning. I personally think that this is the best one. Why? Because it allows you to do the contours, those curved parts of your teeth that go into the gums, to reach over there. With interdental brushing, which is also another very good method of cleaning. The problem, I think, is that it comes in different sizes, and then you need to buy like 3 different sizes and then keep them there. Whereas with floss, if you practice, if you are patient in developing the dexterity and the that you need in order to reach all the different areas, you can actually reach more of the tooth surface with flossing versus interdental brushing. There might be people who disagree with that. Some dentists say no, you should be using interdental brushes, which are these small toothbrushes basically that you put in between your teeth. And I personally don't have a problem with either. I'm just saying that I believe that there is research that shows that with floss you can reach more of the interdental surface than with any other method. There are other ways as well that people use, but flossing is numero uno, I think, and it's been in use for such a long time, and it is very effective at removing those food particles from between your teeth that then get all these horrible bacteria developing. So this is absolutely essential and something we should all be doing. Any child that is over 10 years of age who has their adult teeth in place should be doing it. Anyone less than that, be very careful, because it's easy to irritate the gums of children. And if they have their baby teeth, then absolutely there's no reason to do interdental brushing in those cases. Toothbrushing is sufficient, but once they get their adult teeth, then you can use flossettes or you can use floss. Either option is fine for interdental cleaning. Okay, let's go to the next slide. And the holy grail, toothbrushing. Manual versus electric. I think there is absolutely no question about it now that electric toothbrushes have significant advantages over manual toothbrushing and is the way forward. If you want to invest in your long-term oral health and hygiene and in your dentition, then go for an electric toothbrush if you can. It reaches a lot more parts of the teeth, and it also protects your gums by having these inbuilt sensors that a lot of the modern electric toothbrushes have, which make sure that you don't press so hard against your gums and actually cause them to recede. And they actually, like I said, they cover more of those hard to get to areas, and you don't need to do those circular motions. You just glide them over from side to side when you brush your teeth. So a strong recommendation would be, and you'd actually be saving money in the long run. If you use an electric toothbrush, you are much less likely to have cavities and plaque and all these other problems with your gums and teeth. So that is the third of the main things. So fluoride-containing toothpaste with 1,400 parts per million or over of fluoride, having interdental cleaning techniques like floss, and having electric toothbrush. Next slide, please. If you don't do it, this is what happens. You get plaque formation, which is a film of bacteria that builds up near your gums, and it causes inflammation. Your gums recede. That bone that is holding the teeth like cement, it gets worn away, and your teeth begin to fall out. And this is the consequence of improper brushing. So we're going to talk a little bit about how to brush your teeth properly. If we go to the next slide. Right. Again, the problem, so we talked about the buildup of plaque, and if plaque and sugar and all these other things are staying on your teeth, you can also get these things called caries or cavities, which are holes in the enamel of the tooth, and when it reaches down to the root, it can be extremely and excruciatingly painful. One of the worst pains you can experience is dental pain. For those who've had it, it's absolutely intolerable for some people, and you can avoid it by using these 3 methods of keeping your teeth clean. And there you have an example of a child with a horrible looking cavity in one of their teeth. Let's go to the next slide, please. This area is the war zone. It's that line, that gum line, where the junction of where the tooth enters into the gum. This is the area that we must focus on when we're brushing our teeth. Whether it's a manual or an electric toothbrush, this is the area you really, really don't want to miss, and you have to target. It's absolutely imperative. This is where the bacteria hang out. It's like a cafe for the bacteria, the nightclub.
So flossing would help a lot with this, I'm assuming.
So this is more targeting with the toothbrush, right? Because
the electric toothbrush.
Yeah, because this is the gum line that is actually on the outside and the inside of the mouth.
Okay, so not along not between the teeth.
No,
okay.
Yeah, that's the gum line on the outside and on the inside of the mouth. Let's go to the next slide. Are there any more? Yeah, so the angle of attack in this war zone is 45 degrees, and you can see this is how you should be pointing your toothbrush if you want to reach this area where all the bacteria hang out and party, and you have to really have that angle right, and this is how you make sure that you don't get all of these different problems of gingivitis and periodontitis, etc., etc. So yeah, 45 degrees, aiming the toothbrush like that. Next slide. And if you have a manual brush, it's the same principle. And I think the most important part to highlight here in this particular picture is that whether it's an electric or a manual toothbrush, that bottom right picture where you can see the toothbrush angled on the lower teeth, front lower teeth, that area should be cleaned in this particular method. This is the area that is most susceptible to plaque formation, which is that bacterial film that we were talking about before, that can then turn into tartar or calcification and cause horrible problems with the teeth. So again, you angle it at 45 degrees, and you have to brush the front and the front of the teeth in the top section and the bottom section with the right method of holding it. And you can't imagine a child less than 7 years old, they wouldn't be able to do it.
Yeah, it's a very neglected area, I think, in general.
Yeah. And you should be brushing your teeth of your children up until at least 6 years of age, and ideally 7, until you're confident that they can manipulate the toothbrush in these different directions. Otherwise, they will have problems. Next slide. And to summarize, you can see here your daily oral health routine, and it has these 4 sections in it, which is the morning brushing. Some people say, should I brush before breakfast? Should I brush after breakfast? The latest evidence is suggesting that you should be brushing after breakfast. You gargle your mouth, and then you get the remainder of the any kind of things out of your mouth, and then you brush your teeth in the morning for 2 minutes. 2 minutes is that critical time with fluoride toothpaste after breakfast in the morning. Then after meals. Now, ideally, if you could, if you have lunch and dinner, if you could brush after lunch and after dinner, would be fantastic. But after meals, it is sufficient to rinse your mouth with water. Sugar-free gum is also an option because saliva is acid neutralizing, and that can get rid of that damage that's done during lunchtime. Ideally, of course, if you can brush your teeth, then that would be also a recourse for you. Evening routine, you have to floss. Now, evening and nighttime is where flossing happens, and flossing or interdental cleaning always happens before brushing because it brings out that debris between your teeth and then you brush it away. And that's the best way to do it. And again, flossing should be done over 2 minutes, just the same as with brushing your teeth. So 2 minutes is, again, that magic number for flossing and brushing. And if you have to do it at one time, flossing is best done in the evening. And the last part is tongue cleaning. There's bacteria, yes, that can sit on the back of your tongue, and some studies have indicated that this can contribute towards the phlegm production as well as causing throat infections because people are not adequately cleaning their gums, and using a brush to gently glide it over your tongue is a very good way of doing it. And tongue scrapers are also fine, but be very careful with them so that you don't damage your tongue. So brushing before bed is crucial as saliva production decreases during sleep, leaving teeth more vulnerable to acid attacks. if there is one time where you should never ever miss toothbrushing, it's at night before you sleep. Please brush your teeth twice a day as a minimum, and make sure that you floss in the evenings. It will improve your health. The Imam Jafar as-Sadiq said it will improve your eyesight, and it will improve your cognitive ability. And, as Arsene Wenger demonstrated, your athletic performance.
I mean, this is quite a way to sell brushing your teeth. That hadith is very powerful. The fact that it can actually help your cognitive ability, your eyesight, this is something I would never have.
Cardiovascular health.
I would never have thought that there was any connection at all.
Mental health, right? And the Imam is saying that it takes away your depression, having clean teeth. So let's get busy.
Yeah, and there's no reason not to. I think we live in a day and age where that really should be something that everyone is doing. So, yeah. Very good information, but it helps, doesn't it, to know these little kind of ins and outs of the process and why it's necessary and what to do or what not to do. I think these conversations are definitely needed.
Yeah, absolutely. I mean, how many people on a consistent basis clean interdentally? You know, if we were to take a survey in the local population, you'd find actually it's less than 30%.
It's definitely not promoted as it should be.
It isn't.
It's not. So there you have it. And if you have more questions and you want to talk about more issues regarding health, please go to Facebook and search for Medicine of the Mahdis, and you will have direct access to Dr. Irfan and his colleagues. And I think that's brilliant.